the support, it's from him. Because he will never let us deal with any matter without him being with us. So, Minister, here are your foot soldiers who are not only giving patient treatment, but they are always making sure that the well-being of the patient is there. When I tell people that I work with nurses, if a patient doesn't have transport money, they take the little that they have and pay for something that media will not tell you. They will take money from their own and give the patient. This is to what extent that while we might have one or two out there, but the majority of them are like this team that we have seen here in FH Odendaal. The bravery that I've seen myself when I arrive here, it will go a long way for me to always appreciate that. Minister, you can address your
Thank you. Thank you. MEC, the district office, district director, the CEO of the hospital, SH Odendaal, and the clinical manager and all the top management, the representative of the acting district mayor, the representatives, the councillors, on behalf of the local municipality, the acting mayor, and the councillors present, the chairperson of the hospital board, and the members of staff and media who are present here. We just asked, I hope you can all hear, we just asked that we must come and greet you, to say to you we are here just to look at the tragedy that happened in this particular hospital. When I was informed about this, I was in Nongoma, so we're going to pay respect at the fallen, at the Queen who has just departed. And as I was walking in, the MEC called and said, "I've got a disaster." It was shocking, very sad. And then I said, "You know, MEC, let me come over there and see you and the staff, because it's a very painful situation that you have all gone through. All the patients who come to hospital come here with the hope that when they go home they will be better than when they came. And all of us get happy when the patient that you are treating stands up and says, 'Thank you, nurse, thank you, doctor, I'm feeling much better, I'm going home.' And all of us know that you spend your life focusing on how to support the patients, caring for them, and making them to get better, comforting them and supporting them. The last thing you want to see is a situation where you lose a patient for something that was not part of the plan. It's still difficult enough to lose a patient because of the ailment that they had. But to lose a patient for something that was completely outside all our imagination is a very sad situation. So I came here to just convey my condolences to you who have lost the patients in this very tragic way. I also want to convey condolences to the families that have lost their loved ones in the way that this one has happened. It was a tragedy to have a fire break out in a ward. But at the same time, we are also very sad that we even lost a patient. 3 weeks ago, I was in Gauteng in Charlotte Maxeke Hospital. A fire broke out and it engulfed a major part of the hospital. When I was called by the MEC, the first question I asked, "Have you lost a patient?" They said, "No." "Have you lost a staff member?" They said, "No." I said, "Thank you very much, well done." And I said it was a tragedy with a happy ending, because they were able to evacuate almost 1,000, about 800 patients that they had to take out of the hospital. Now the problem with the fire is that the fire rages fast, and you have to think fast and act quickly as well. And the fire doesn't wait until you have got full complement. It comes at a time when you are focusing and thinking that everything is normal. And it quickly moves because of the nature of the stuff we use. More oxygen, more sanitizers, more linen. A lot of that becomes a problem that creates a difficulty in controlling the fire. Now, I want to say, for us as the department who have lost 2 patients, it's very tragic in a fire. It's very tragic. We always want to check how many patients we are losing because of tuberculosis, because of pneumonia, because of gastroenteritis, because of any ailment that is a natural disease which we pride ourselves of being able to manage so that the patients can get better. So to lose a patient with fire is actually a very sad one. So these 2 patients that we have lost, it's a very tragic blow to our health service. And from that point of view, as I say, I want to convey condolences to the families of those whom we have lost. I also want to convey condolences to you as the staff, the nurses, the doctors, the security, the general workers, the paramedics, and all the different categories who are here. Because all of you together are what makes this place a very safe place. But what has been most touching for me is how this fire was contained. I was actually told by MEC, and this now Sister Mnyedana has just given us an account to have, firstly, to detect the fire when you're busy with other things. That I commend her for picking up that something is wrong somewhere. It tells you, whilst you are actually looking for a patient who could be complicating because of vomiting and so on, but to be able to be alert to other disasters that could be taking place around your patient is an ultimate indication of the highest point of care. The fact that they walked in and they found that the fire had engulfed the ward, and then they went in to retrieve the patient at their own risk of hurting themselves, is a big thing. If they came out and said, well, the fire was so huge we couldn't do anything, we would have understood it. But the risk that they took is what has been most touching for us. And of course, to go out there and look for the equipment and say we're going to put down this fire, and gone all out and extinguish the fire, and not say, well, you know, our job description does not involve firefighting. It's an unimaginable show of commitment to caring. So that's the reason why I thought I must see you, just to say to you, I can feel that spirit of caring amongst yourselves that's been demonstrated by these particular staff members. And so we thank you for that. The fact that you were able to go in there, drag the patient out, and in the process get the fire hoses, the fire extinguishers, and extinguish the entire thing. I walked in, all those beds that have been bent, the roof, the walls, the level of destruction shows you the intensity of that flame. Now that flame, you don't need to get anywhere close to that, you feel it from a distance. But that's too late by the time you feel the flame. The real issue is the smoke, which is what causes the problem. I can see how some of the patients ultimately succumbed, because the pollution on the air gives you a problem about how much you can tolerate the reduction of the oxygen in the air. That's what happens with the fire. So I want to thank you for that. But in addition, CO is really a story to tell. We would all be running around and saying, but where were the fire extinguishers? In this case, they were there. Where was the fire hose? In this case, it was there. Oh, but it was not working. In this case, it was. which means that part of the simple basic maintenance can save lives, which is a point which I want to make, that this ward was saved by regular maintenance of fire extinguishers and fire hydrants. Now, never underestimate that and think that I'm here just to give injections and pills. You have to understand that care has to be taken to make sure that all the supportive structures are available to help us as we deal with the patient. So in this case, I want to say to you, for me, this is real heroism. This is courage, and I want to commend this team for the courage that they've shown to walk in there, take the patients, rescue the patients, put down the fire, and turn themselves into fire extinguishers and actually change what could have been an entire destruction of many more people's lives. But in the process, they have been able to demonstrate courage and compassion, all combined. And for you, for that, I want to commend you. That is the reason why I thought it was important for us to come here. And we have obviously seen the level of damage. The one unfortunate inmate situation is very, very concerning. Everywhere where there's a fire, the biggest problem is what we call smokeless suffocation, where you first get what we call the gas, the fumes that come from the fire. They give you, doctors will tell you, nurses, the carbon monoxide poisoning that goes out even before you can actually see the smoke. It moves out there. That's the biggest risk we always worry about in a hospital fire. And in this case, it could actually affect a lot more people. We've then seen how we've been able to evacuate 23 other patients where the fire was moving, where the flame, the smoke was already gone in there. So that for me is something that I think is very, very, touching, the extent to which we have been able to go to save the lives of the patient. So I want you to know as well that we do appreciate the work you do. The chair of the hospital board was telling me that you are attracting patients who come from Mpumalanga province, and mainly that has got more to do with a reputation that you have as a very caring center. Now, that for me is what health services is all about. It's about caring, it's about compassion, it's about making sure that we look after those who are less fortunate. So from that point of view, I do want to appreciate that. I believe that those who have been through this, MEC, thank you for starting the process with the CEO, but we do need quite a lot of support and counseling. Fire causes trauma. If you survive the fire, you are traumatized. If you fight and battle the fire, you are traumatized. If you lose someone in the fire, you are traumatized. And that is why I thought it was important that we must come and say to you, don't feel you have got the trauma alone. We are all with you, and we want you to be strong. So with that, we just want to say that we support the means that have been taken to go and meet with the families, assist them in the burial. We'll support the investigation that will go into to say what would have been the cause of the fire. We won't be speculating, but I think it's important for us to say all of this has to follow a due process of investigation. All that I have for you is just the commendation and support and these sympathies that we have to you. We have heard that work is being done to help the families. We also heard that the hospital, Mametlake, yes, that Mametlake is assisting. We do want to thank Mametlake as a hospital, the leadership of the community around Mametlake, from CTWs to community leaders to councillors, to the district office, to the Mpumalanga Health Department, for coming on board to assist and support. They didn't turn around and say, well, it didn't happen in our hospital. But they are there because we're one country, one government, one service. And so we want to thank them for that. I think it's also important to say that this happened in a very difficult ward, which is the COVID ward. We all are aware that the COVID situation that we're facing now, although we've had a bit of a lull, but the last wave, Limpopo had a bigger wave than the previous one. So you've seen more COVID in the last wave than you had seen previously. It makes us all remain at risk because the COVID situation in the whole country remains the one which is really under serious observation. We are concerned that all the people must take it seriously, keep their distances, keep their masks, and washing of hands and sanitizers. All of that is important so that we don't have an explosion into the next wave. So all of that is something that was part of what we are already dealing with in this COVID ward. Of course, we are at this point looking forward to the vaccination program. We all are aware that there's been some delays. We had already announced that we had unfortunate delays on the Johnson & Johnson, all of which has been occasioned by some problems that have got nothing to do with us, but have got more to do with the auditing of the procedures in relation to the manufacturing process happening in America. And that has taken us to a point where, because it's one now part of the global value chain, we have to wait until they complete that. And they've given us that probably next week they will then be releasing the supplies, because all of our vaccines are ready, they're packed, they're stored, they're waiting just to be given a go-ahead, and then they will come home. I was talking to Johnson & Johnson Global Office yesterday and asking them whether they couldn't release these vaccines. And of course they indicated that some of these procedures are a matter of safety, which we now need to make sure that it's all confirmed so that we move on. So it will be coming through, but we have already received the first batch from Pfizer, which is about 300,000, but we will be receiving all of these 300,000 every week until the end of the month. Then that will be doubled to 600,000 every week until end of June. We are really pushing to get more and more vaccines, so we're distributing them all across. The next phase, which will be starting in the around the 17th of May, will then be focusing on the community. By then we would have made sure that as many of us as possible of the health workers have been vaccinated. We are aware as well that at this point we're getting closer to the 500,000, although we would have wanted to see that happening much earlier. And of course at this point it's a Johnson & Johnson that we'd had to delay for a while based on the fact that we needed to investigate the incidence of clot disorders that were reported in the US. Out of that process, it has been established that we can continue with the vaccination, so that will continue. Part of what this study that we're doing with Sisonke is to look at, if we've vaccinated so many people, how many still don't get as much immunity, and then they get what we call breakthrough infections. That is what this study, the first part, was actually observing. It will give us a much better sense, although already you will see at this point that our information suggests that we don't have as many people who are infected, but we must expect that there may be instances where you will still find some of the infections showing up. Just depends on the level of immunity that people are able to generate. So that is a process that is ongoing. But the whole year, as we're receiving all these vaccines, we will still need to use our masks, distancing and sanitizers, and never let down our guards, because out of that process we will actually find it that there's a whole emergence of additional outbreaks. There's been a lot of concern about what happens in India. Now India has got an outbreak that's really taken a huge a number of people who are infected and the numbers of deaths. They've got a different variant, B1617. That variant, when I ask our genomics experts, they say it's actually got less mutation than what we have in South Africa. In other words, they also found that it was still sensitive to people who are immunized with AstraZeneca, Pfizer, etc., which is not the same as the one that we've got in South Africa. The one that we have in South Africa has got more mutation problems than the one that is in India. But there's a lot of concern that maybe people are coming from India to to spread the infection in South Africa. We have actually been identifying people who have come from India. We're testing a number of people, and we have still not identified that variant that's in India. But I also want to say that even if that was identified, let's just look back at what we've been able to do in South Africa as the people of South Africa. By just being very strict on the containment measures, we're able to get over a very difficult wave with a much more problematic variant than the one that is seen in India. So we must understand that even if we don't have people coming from India with a variant that comes from India, we still have a variant that can cause more problems for us. So we need to actually focus on what we can do to reduce that spread. Because if we do so, we will then be able to counter what would have come from any other countries. Although we'll look into the other issues of restrictions on travels and so on, that's issues under discussion. But the key now is how we make sure that amongst ourselves we keep the issue of containment measures alive. We have to do so until we finish the whole vaccination process. As we have said, in some provinces it will go up until sometime next year. So I'm just saying therefore to you that whilst you have the challenge of fire, that was just an accident. But the real issue, we must still focus on the COVID-19. We also need to understand that COVID-19 is just one problem. There are still other problems of HIV, of TB, of diabetes and so on that we must still look after. Because if someone can be saved from COVID and still die of HIV or TB or diabetes and so on, we still haven't done what we needed to do. So we need to now see how we integrate all of this with our normal regular services so that we are able to give our people the best possible care, a package of care that is possible. Having said all this, I just want to say that to you, to the members of staff, we know you shouldn't be here, all of you, because you are busy at work. We just wanted to say thank you for the work you do. Thank you for caring, and thanks to this team for the courage and the commitment to save the lives that we have seen them do. And we want to once again wish you all the strength, and we also want to convey condolences to the families and to you as staff who have lost patients in this tragic way. And we want you to know all that you have done hasn't gone unnoticed, and we will always be with you to give you the support and strength. Thank you very much. We just wanted to say that to you so that as you go back to work, you must know it wasn't just a case of fire that ended there. It's touched all of us, and the whole of South Africa was very concerned about what happened, and of course at the end of the day, very grateful for what you did to try and save as many lives as you did. Thank you very much. Thank you,
thank you, Minister, and thank you to the team. I think we should now be going back to I will have to request to check from Dr. Lwazi if you will have the minister will take questions because of the time, because the minister doesn't have time. He has said everything that we wanted for us to hear, so we will be able to release the minister so that he can go back to his other responsibility. But to Team FH Odendaal, once more, we are saying our hero and our heroines, we appreciate 25 patients being evacuated and their lives being saved. It could have been a disaster, as the minister is saying, but you brave that. We'll continue to be grateful. Thank you very much, and thank you.
Thank you.
From Limpopo, it's off to KZN for the memorial service of Lindani Mieni. Let's take you there live as we say goodbye from the agenda for today.